All right, let's get right into it. Today, we're unmasking a condition that is, frankly, one of the most baffling and debilitating out there, complex regional pain syndrome, or CRPS. And believe me, this is a neurological puzzle that goes way, way beyond what any of us think of when we hear the word pain.
Just picture this for a second. You sprain your wrist, or maybe you have some kind of minor surgery. You expect to heal in a few weeks, right? But what if, instead of getting better, the pain just doesn't stop? In fact, it explodes into something totally monstrous, something you can only describe as bone-crushing.
Well, for people living with CRPS, that nightmare scenario is their day-to-day reality. It's a condition where the entire nervous system basically goes haywire. And that intense, relentless pain, that's really just the opening act. It's the first sign that something has gone profoundly, deeply wrong.
So let's start with the single most defining feature of CRPS. This is the big, flashing red light that tells a clinician, whoa, this isn't just a normal injury.
This right here, this isn't just a description someone came up with. It is a core part of the diagnosis. The pain is completely, utterly disproportionate to whatever started it. We're talking about pain that people describe as paralyzing from an injury that should have been a distant memory. This massive mismatch between cause and effect is the very first clue we're dealing with something else entirely.
And here's the second huge clue. You know how if you pinch a nerve in your back, the pain shoots down your leg along a very specific path? CRPS doesn't do that. The pain is regional. It spills over. It floods an entire area, a whole hand, an entire leg, even if the original injury was just to your pinky finger. That tells us the problem isn't just a damaged wire in the limb. The problem is in the central control room.
But here's the thing. It's not just about pain, not even close. CRPS shows up with this whole collection of symptoms, which doctors have grouped into 4 distinct categories. And you need these categories to really see the full picture of what's happening.
First, in the sensory category, you have something called allodynia. This is where your world gets turned upside down. Stimuli that should feel normal or even pleasant become agonizing. We're talking about the simple touch of a bedsheet on your skin or a light breeze causing a wave of searing, burning pain. It forces you to see your entire environment as a threat.
And right alongside that, you have hyperalgesia. This is different. This is when something that should be a little bit painful feels extreme. So a tiny little pinprick doesn't just feel like a prick, it feels like a major injury. Both of these symptoms, allodynia and hyperalgesia, are screaming that the nervous system has become dangerously, exquisitely hypersensitive.
And what do those clues point to? A phenomenon called central sensitization. This is absolutely key to understanding CRPS. The best way to think about it is like this. The volume dial for pain in your brain and spinal cord has been cranked up to 10, and now the knob is broken. It's stuck on maximum. The central nervous system itself is now malfunctioning, amplifying every single signal it gets into a full-blown crisis.
So here are those 4 categories doctors use to piece it all together. We've talked about the sensory signs, that's the allodynia and hyperalgesia, but then you have autonomic signs. This is wild stuff, like the limbs suddenly changing color, going from red and hot to cold and blue, or sweating when the rest of the body isn't. Then there are trophic changes. The skin can get all shiny, and hair and nails might start growing in strange ways or not at all. And finally, you've got motor symptoms, things like profound weakness, tremors, and even the limb getting stuck in a painful, cramped posture.
And to make it even more complex, CRPS isn't static. The way it looks can actually change over time. Clinicians often talk about 2 main presentations, or phenotypes, that they call hot and cold CRPS.
So early on, you often see what's called hot CRPS. The limb is actually warm to the touch, it's red, it's swollen, it looks like a classic inflammatory reaction. But as time goes on, it can shift into cold CRPS. Now the limb is cool, maybe even has a bluish or pale look to it. This change is really significant because it suggests the problem is moving away from a local fire, so to speak, and becoming a much deeper, more centralized nervous system problem. And a person can even shift back and forth between them.
Okay, so you've got all these bizarre, shifting symptoms. How on earth does a doctor confidently say this is CRPS and not one of a dozen other things? It is a huge challenge, but they do have a very specific tool they use to crack the code.
And that tool is a very specific checklist called the Budapest criteria. Honestly, you should think of it less like a checklist and more like a detective's rulebook. It's a structured way to make sure all the right clues are there before slapping on such a serious diagnosis.
And you can see just how strict this process is. First, you need that core feature, pain that's way out of proportion. Then, the patient has to report symptoms in at least 3 of those 4 categories we talked about. But just saying you have them isn't enough. The doctor has to personally see objective signs in at least 2 of the 4 categories during the exam. And finally, and this is so important, they have to rule everything else out. No other diagnosis can better explain what's going on. It sets a very high bar, and for very good reason.
So now let's move away from the diagnostic criteria and talk about the true cost. Because these symptoms, they don't just live on a doctor's checklist. They create this devastating ripple effect through a person's life that leads to just profound disability.
And this right here, this is the vicious cycle that can trap someone. It all starts with that intense pain. Naturally, that pain makes you afraid to move the limb, so you stop using it. It's called fear avoidance. But here's the cruel twist. Not using the limb makes everything worse. The muscles waste away, the joints get stiff, and guess what? That just creates even more pain. And around you go, spiraling down.
This whole situation leads to a really fascinating thought experiment that clinicians will sometimes pose to patients. They'll ask, okay, let's pretend I have a magic wand. If I could wave it and, for just 1 minute, make all the pain completely disappear, could you move your arm normally?
And chillingly, for so many patients, the answer is still no. Even in this imaginary pain-free state, they feel like they still couldn't move it. And that answer tells us something so profound. This isn't just about pain anymore. There has been a fundamental breakdown in the communication lines between the brain and the limb. It's like the brain's internal map, the very blueprint for how to control that body part, has been scrambled or erased.
The physical damage is obvious, but the psychological cost is just staggering. Just look at this number on insomnia. One major study found that a jaw-dropping 92% of CRPS patients suffer from it. I mean, how can you sleep when your body is screaming at you 24/7?
And it just keeps going. That same study found overwhelming rates of anxiety and depression. People report poor memory, poor concentration. But this mental distress isn't just a side effect of the pain. It actually becomes fuel for the fire. It creates its own feedback loop, physically worsening the brain's perception of pain and making the whole thing that much harder to bear.
And this really gets to the heart of why time is of the essence. As the research makes painfully clear, once you get to the point of deep structural changes, we're talking about muscles that have atrophied, joints that are permanently locked up, the condition is often considered irreversible. The damage is done.
So it all comes down to this. Being able to recognize this incredibly complex pattern of signs is the first and most critical step toward helping someone. Early diagnosis isn't just a nice-to-have, it's everything. Which leaves us with a pretty urgent question to think about. Why is catching these signs early the absolute best and maybe only real weapon we have against this devastating condition?